that the dam levels at the pumped storage schemes will be fully replenished by Monday morning. The Center for AIDS Program Research is currently evaluating new TB diagnostic systems that will link patients with their results instantly. Now, this ahead of the 7th South African TB Conference at the Durban ICC starting on Tuesday. Professor Kogie Naidoo, CAPRISA's head of TB and HIV treatment research, says the new test will also revolutionize the diagnostics of drug-resistant TB. The latest data points to 10 million new global TB infections annually. CAPRISA says South Africa is among the top 30 countries for TB infections.
TB is caused by bacteria that spreads from person to person through the air. In most cases, the disease is curable with the right treatment. But a form of drug-resistant TB may occur when the bacteria becomes immune to the drug. According to experts, South Africa has about 7,000 drug-resistant TB patients every year. The two strains are extensively drug-resistant TB, known as XDR-TB, and multi-drug-resistant TB, MDR-TB. Experts say both are treatable but require a quick diagnostic test and a complex treatment regimen. In 2013, government introduced a new test that can produce results in less than an hour at a centralized laboratory. But experts say the centralized location means that the patient still has to wait days for the results to filter back to their clinic manually.
The patients have to expectorate a sputum. The sputum will go to the laboratory. The laboratory deals with hundreds of thousands of specimens each day. They need to generate a result. The result, we don't have a secure electronic mechanism to dispatch results to facilities and to patients. So with COVID, we got very spoiled. We got a COVID PCR result on our mobile phones. But with TB, you need to go to a facility to access a test and access a result.
Naidoo says a new and quicker test has been endorsed by the World Health Organization. CAPRISA is currently running a 2-year study on the test to evaluate its efficacy when implemented in diverse settings.
Now we have a new test that we are evaluating that not only tells you that you have TB, but also tells you about the drug resistance profile of your TB organism. It'll tell you whether you could take the ordinary TB treatment for drug-sensitive TB or whether you require a more complex second-line TB regimen for drug-resistant TB. In the past, we would wait anything from 20 to 42 days to get a result, but now this new diagnostic has revolutionized the diagnosis of drug-resistant TB in that we can get a test result within 80 minutes.
Naidoo says new candidate vaccines have also emerged in TB prevention.
So there are several candidate vaccines that have been that's being evaluated in the field, and the one that's really advanced is a vaccine called the M72AS01E. It's a bit complicated, doesn't have a sexy name as yet, but that vaccine was shown to protect half of those that received it in progressing to TB disease. And the importance is that that vaccine was shown to be effective in people living with HIV.
Naidoo says hope remains for a breakthrough despite the setbacks caused by COVID-19. Bongani Gema, SABC News.